Um, well, as you know, tonight we're talking about the cesarean epidemic, and epidemics sort of loosely defined as something that is not always good, that's out of control. I suppose if you're in a flu epidemic and you're suffering from some terrible disease and it wipes you out and you wanted to die anyway, that's a good thing about an epidemic. But I'd like to start with a story that actually happened in Pinellas County that is the kind of thing I think that really bothers me a lot. One of our women faculty members at the College of Public Health over at USF. Oh, and I want to introduce Dee, by the way. Dee is my partner and nurse, and we worked together to found the Lawton and Rhea Childs Center for Healthy Mothers and Babies over at the College of Public Health about 12 years ago with Governor and Mrs. Childs. And Dee is a childbirth educator, been very active in the state and working on a lot of these things, but mainly right now, just so you want to talk to her afterwards, she's on the National Board of the Childbirth Connection, which is the group that really does the nicest scientific research of anybody in the country to back up everything that we're all interested in. So their website's childbirthconnection.com. So .org. Oh, that's right. They're not commercial. And so if you, she does keep me honest. And so if you, as nurses are supposed to do for doctors, and they do all the work and we get all the credit, and that's supposed to be the way it is too. So at any rate, the story I was about to tell. This was about 2 years ago, and a young woman, faculty member at the college, had a sister who was pregnant with her first baby and was over here getting care. I don't know from whom, or I'd probably tell you, but from a woman OB over here. And I mention woman because when I was a resident in OB 40 some years ago, only 6% of people in OB were women, and now it's more than half. And we sort of thought that would be the salvation for the specialty, but it hasn't really quite worked out that way in all instances. At any rate, she was going to this woman, and she lived over here, and about 28 weeks, she and her husband moved to New Tampa over in Hillsborough. And so she sat down and talked to her doctor at the next visit and said, "We're moving. Can you help me find a doctor in Tampa? Can you recommend somebody over there? Because this would be a long way for me to drive in active labor." And the doctor said, "Well, don't worry about that. We're going to schedule you for your cesarean about 3 or 4 weeks before your due date, so you're not going to have to worry about driving over here in labor because you'll have it all over and done with, and you can just come over on the day you're going to have the surgery." And she said, "Well, I have no intention of having a cesarean section." She said, I've gone to classes, I plan to have a vaginal birth, and that's what I want." And the woman said, "Well, that's the way I do it." So the upshot of it was that she wouldn't help her find somebody in Tampa. That's probably good because of who she might have helped her find. But she found a doctor in New Tampa that would help her do what she and her husband wanted to do. But then the doctor over here wouldn't give her records. And so in spite of calls and writing and sending record requests, she wouldn't do it. Well, that last part is just totally unethical. Even if somebody can't pay you or doesn't pay you, they always have a right to the medical records because they are theirs. And the best thing to do would have been to Xerox and give them to her, let her carry them over. But of course, we can't trust patients with their own records. Even though in the military and the Navy for 14 years, I carried my records around and didn't lose them because I was pretty sure I was going to get all those shots again. So, but at any rate, that's the kind of thing that's happening, and that's really worrisome and of big concern. The statistics, as you probably know, in Florida on cesarean section are that were 2 years ago we were up over 36% for the whole state. It's 1 out of every 3 pregnant people gets a cesarean. And in some parts of the state, it's over 70% in South Dade County. And if you look at the statistics from the Agency for Healthcare Administration, the hospital with the lowest rate in the state is Shands in Jacksonville, which is about 19%. And the highest in the state is South Miami Hospital, which is close to 70%. What's wrong with this picture? South Miami is a private hospital that deals with mostly healthy people. Anybody that's not goes to Jackson Memorial. Shands Jacksonville is the Jackson Memorial for Jacksonville and takes all the really sick, high-risk people, and they have a cesarean rate of 19%. So, and then it you know, when you start talking about what's wrong with this picture, and I'll leave this with Ann, I asked the folks at the state to look at our ranking, and now here we have a cesarean rate just going up and up and up and up in Florida. At the same time, our outcome statistics are getting much worse. You know, I'm in OB and public health, so we're 32nd in the country in infant mortality. When we started working on it, Dee and myself, in the early 80s, we were at the bottom 10 in all the states. And our infant mortality was 14 per thousand. By the year 2000, with a lot of different things going on, a lot of work, we got it down to about 7%, or about half that, which got us up in the upper third of all the states. Now we're hovering on the edge of the bottom third, because since the year 2000, things have gotten worse. I chaired the March of Dimes Prematurity Prevention Committee for the state for about 5 years. And during that time, the cesarean rate went up like this, and the prematurity rate went up like that after staying stable for many years. So we started thinking, is there a relationship here? And the state health department started looking into it and found that there is an association between the rising cesarean rate and the rising preterm birth rate. And we're studying that now, and the study will be done in October. And we've looked at many of the large hospitals in the state, 6 with the lowest cesarean rates and 6 with the highest, to look at what's really happening and why these babies are being brought out prematurely. But what it looks like is that for most of those late preterm babies from 36 to 38 weeks, many of whom don't do very well, the doctor is mistakenly thinking that they're further along than they are, and saying, well, you're only 2 weeks from term, you're 38 weeks, we can go ahead, and they don't even induce labor, they just go straight to a cesarean. And lo and behold, the baby's 4 pounds and has to go to the neonatal nursery, doesn't do very well, and so on. And I'll talk more about that in a minute. But and we're 50th of all the states in cesarean percentage. Only New Jersey's worse, so obviously we're throwing in the District of Columbia there. So we got some problems, and yet, you know, our cesarean rate's going up and our outcomes are getting worse. So it's something to be really concerned about.